Historically, conventional medicine and alternative medicine have resided at opposite poles of the medical spectrum. But recently, there's evidence that the previous clear lines of distinction are becoming blurred and that tentative bridges are being built between the two approaches. For almost 2 centuries, the traditional medical community and practitioners of alternative medicine have eyed each other warily across a wide chasm filled with skepticism, mistrust, and sometimes outright hostility. With this history in mind, it's all the more remarkable that in the last several years, the gulf separating these seemingly incompatible approaches may actually be beginning to narrow. The American Medical Association, which once declared alternative medicine the sole province of charlatans, has now urged its own members to become more informed with alternative techniques. And alternative medicine is now part of the curriculum in more than 3/4 of medical schools in this country. What is prompting this dramatic change in attitude? Well, to begin our look into this phenomena, we eavesdropped on a unique monthly meeting of classically trained doctors who have a wide variety of clinical specializations and who have begun to incorporate alternative medicine therapy into their respective practices. This group of doctors meets informally over dinner to discuss medical philosophy, developments in alternative medicine, and case studies from their various practices.
A couple of years ago, I started noticing more and more as my patients would come in and I would ask them what medicines they're on, they'd be on things that I couldn't spell. Ginkgo biloba and echinacea. And is that euthanasia? No, echinacea. I said, good, I'm glad about that. And the more and more people that came in on these different herbs and occasionally homeopathic medicines that I didn't know anything about, the more I was interested in finding out about them.
When it came to preventing illness or to doing early intervention when people had not yet developed some terrible illness, I really had very few skills, and that's where I really began to look around to where I could help probably the majority of my patients who were coming in then and still are now, who what I call the gray area. They weren't sick, but they weren't well, and they needed help. Most of it was stress and lifestyle issues, and that's really where I began to focus. So I was looking for some tools that I could use to get them to that first level so they could begin to feel what it was like to be healthier.
But I remember always feeling disappointed with the effectiveness of a lot of the pharmaceuticals, especially when it came to chronic problems that I was seeing in the clinics. I kept thinking there's got to be a better way. I was really shocked to discover that there was this whole system of medicine that was completely different than what I had just spent the last 7 to 8 years learning about, and that a system that has a very rich history. Not just homeopathic medicine is not only widely practiced throughout Europe, but it was very widely practiced in this country at the turn of the century. I think I kind of felt like Rip Van Winkle, who was asleep for 20 years and then awakened to find this whole new world out there.
I remember growing up with herbs and herbal doctors, where in Asia or in traditional societies, herbal medicine is conventional medicine, and Western medicine is the alternative. And in that way, we lived with herbs. And so for me, much of this is going back to my original roots.
When I first told my faculty advisor, when I completed my medical training, that I was interested in going into alternative medicine or nutritional medicine, he just looked at me for a moment and he said, "Are you sure that you really want to do that?" And I said, "Why?" And he said, "Well, you'll be talking to people about lifestyle and diet all day." And I said, "And?" And he said, "You won't be making any more money than a psychiatrist." He said, "You have a wonderful career ahead of you. Why would you want to do that?"
I think that if 6 or 7 years ago I had mentioned to my peers at the medical school that I was even doing acupuncture, I would have been shown the door. But I think now they're sort of eagerly embracing the possibilities of a number of these treatments.
But I think we can't cave in to the pressure, to some of the pressure I think that many of us feel to sort of just swing the other way and say, fine, anything that's alternative is good, because I'm worried when my patient comes in and says, look, I'm taking human growth hormone and I'm taking DHEA, what do you think? I feel I have to be honest with them and say, look, these are powerful hormones, I don't know.
One phenomenon about alternative or complementary medicine is there's a lot of sorting out to do. There's a lot of riffraff. And there are a lot of things which don't work as well as things which do work.
Today, just as sort of for fun, I went online and I did a search on the internet and on Medline of DHEA and also of human growth hormone and ginkgo biloba and echinacea. And there are thousands. There are thousands of articles. Imagine you're a patient trying to find information this way. It is like drinking from a fire hydrant.
I think it's incumbent on some of us who are working in the field to really make this kind of, for us to begin to do some of the sifting and to help people really see what's the important research, or at least, what's the more rigorous research, no matter which system it was done in.
I think the most telling thing about where alternative or integrative medicine is going is that the generation of doctors that's coming up now through the medical schools is incredibly interested in this. I mean, a number of us teach at medical schools, and we can all testify to the clamoring from young doctors or doctors in training to learn about this stuff. And I think that says more than anything else about where medicine is going.
I think none of us here really are doing alternative medicine. I think we're really doing complementary integrative medicine, where we're taking the best of whatever works in conventional and quote-unquote alternative medicine and weaving them together.
I agree with Woody that the term alternative medicine is maybe an unfortunate term, because imagine defining yourself as alternative. You see this thing over here? That's traditional medicine, and I'm everything it's not.
What exactly is alternative medicine, and where did it come from? Well, to help us comprehend the realm of alternative medicine, we've asked Dr. Isidore Rosenfeld to join us. Dr. Rosenfeld is a distinguished professor of medicine at New York Hospital Cornell Medical Center and author of several bestsellers, including Dr. Rosenfeld's Guide to Alternative Medicine. In your book, you state that alternative medicine now has one foot out of the closet and that the gap between this other medicine and conventional medicine is narrowing. Why do you think that's happening?
I'm a practicing doctor. Every day I see patients in my office, and I'll tell you what alternative medicine is. A patient comes into me and says, look, I've got Parkinson's, or I've got cancer, or I've got multiple sclerosis, or I have deforming arthritis, or I have chronic fatigue syndrome. They list off all the things that scientific doctors like myself cannot really successfully cure. And they say, you've done all you can. Now, I have heard that there is a clinic somewhere, that there is an herb somewhere, that there is some treatment that you don't know about and that your colleagues don't agree with, and that is alternative medicine. Should I do it?
And what do you tell them?
And I tell them, if you and I together have explored all the possibilities for your diagnosis and treatment, if I have sent you to the best people I know for a second opinion, and we are up against it, then I have no objection to your looking into some of these other things, provided, A, you tell me about them, so that whatever you're getting does not conflict with what we know does or does not work. I don't want you going off secretly and getting this treatment. I think, you see, that is the big danger in this whole thing about alternative medicine.
In general, what is this other medicine, though? Where did this come from?
They come from experience. They come from doctors and healers, if you will, over the centuries, using some of these products to treat people with disorders for which there is no cure. Now, as long as they don't do harm, as long as they are not used in place of therapies that do help people, then I have no objection to them. What worries me is somebody with a curable cancer who comes and says, I'm not going to take the radiation, I'm not going to have the surgery, I'm not going to have the chemotherapy because that's poison and I want a natural product. That's bad. I think there are things in this other medicine which can be incorporated into the treatment that doctors like you and I give our patients. And in talking to some opponents of this so-called alternative medicine, I think they turn a blind eye and a deaf ear to some things that have in fact been researched. I, for example, in my practice, use ginkgo. I use echinacea. I use saw palmetto for enlarged prostates. I use feverfew to help prevent migraine headaches. There are a few very good herbs. I use St. John's wort for mild depression. Now, some of these herbs have been scientifically checked. In recent months, because of the pressure on doctors to look into these things, there's been reports in the JAMA on ginkgo, on St. John's wort, and other drugs.
I think another one of the problems with this whole area is that a lot of the conventional ways that medicine has used to study treatments, to study drugs, don't really apply to many of the unconventional approaches. So there's a big need now for people to look at new ways of doing research.
I think it's very important to not give up our standards of our traditional standards as well as we can design them, placebo-controlled, double-blind or single-blinded studies to see whether these remedies really work.
How do we study it to see what's working and what's not? And, you know, do we use our traditional ways of looking at these things scientifically, or do we need to find another methodology?
Perhaps we can comprehend alternative remedies being prescribed by a physician along with conventional medication, but can you conceive of alternative therapy being done during critical open heart surgery? That is exactly what is happening at the prestigious Columbia Presbyterian Hospital in New York.
The surgeon said that I was extremely relaxed on the operating table.
Is it a random act of God that something is happening, or truly is it the therapy itself that's eliciting a response?
It's a blending of the body, mind, and spirit.
The difference between allopathic medicine, Western medicine, and complementary medicine is a religious one.
An old maxim says there are no atheists in foxholes. Perhaps the same thing could be said of operating rooms. Yet few in the trenches will admit this, much less explore it. But at Columbia Presbyterian, a new department has embarked on just such an examination. The Complementary Care Center was founded by a small core of true believers, and their mission was an ambitious one: to do the first rigorous clinical testing of alternative therapies or modalities in surgical patients.
Probably one of the hardest things I think a group of people could ever dream of trying to do in a very acute care situation.
Tom Warren is about to undergo cardiac surgery for a tumor in his heart.
Right now I feel very well, feel calm and quite healthy.
Part of the preoperative strategy hinges on a series of audio tapes designed to relax and reassure.
Now we will begin the 10-point system of total relaxation.
But perhaps more controversially, the strategy also includes a more esoteric art, therapeutic touch. 5 years ago, the idea of a well-respected cardiac surgeon working together with an energy therapist in the same operating room, well, that would have been about as far-fetched as the notion of the Spice Girls playing backup to Luciano Pavarotti at Carnegie Hall. But today, in OR 21, here at Columbia Presbyterian Medical Center in New York, that is exactly what's happening. The respected surgeon is Dr. Mehmet Oz, director of the Cardiac Assist Device Program and co-founder of the Complementary Medicine Department. But he is as much a skeptic as an advocate.
There are some aspects of complementary medicine which we have proven are beneficial. A good example are the audio tapes.
You hear my voice clearly, and you remain deep.
Many of these other modalities, like energy medicine, I'm more skeptical of. Why? Because it's more difficult for me to tell if the patient's getting the pill.
But Dr. Oz has an open mind and allows touch therapist Ellen McMahon to join the team to help evaluate the effectiveness of this therapy.
We all have electricity around our body, and it's using that finite electricity in a very gentle way to get into a state of balance.
With origins rooted in ancient Chinese medicine, touch therapists believe they can manipulate the energy field that radiates from the body and promote healing with their hands. I'm curious how you think this interaction works, and how do you believe that it works in terms of a patient who's unconscious, they're sedated, there's a whole variety of medications and drugs. How do you get through all of that?
Because your energy system is there. Just because you're asleep doesn't mean that your arm isn't there. Here, they're dealing strictly with the body. And if we can join in with the flow of the spirit and the mind, it's a wonderful support system.
It's difficult to see or define what Ellen senses. Energy auras have been recorded with special photography, but a method of measuring this phenomena, let alone a therapist's influence over it, has yet to be devised.
It's the major obstacle holding back feels like energy medicine.
Now, do you find that frustrating? I mean, because there's really no way to assay the medicine here.
It is very frustrating for energy medicine, but there are other therapies where it's not so nebulous.
Good. And as your hands begin to come down to your lap, now you can begin to reorient back here.
The department is currently studying 9 different modalities.
We have hypnosis, guided imagery, visualization, the body type experience. We have massage, reflexology, and acupressure. And the mind, body, or movement therapies, we have yoga, tai chi, and qigong. And those are palatable type of therapies that pretty much fit the mindset of the institution, the clinician, and patients.
It's sort of just a dull, overall, like somebody punched me.
David Fidlin, a multiple bypass patient, never had any previous experience with alternative therapies.
The experience was wonderful. I had never realized how much breathing can help you relax. And with the hypnosis therapy session that I had and a series of tapes that they gave me to reinforce those sessions, I found myself with an incredible ability to relax.
The overriding thesis of everything we do is that health is a body-mind phenomenon together.
Elizabeth Poole is an acupressure therapist, another kind of body work based on Chinese medicine.
You just try to find energy blocks. And using hands, you can either encourage an energy block to dissipate, or you can encourage energy that's deficient to come. It's enhancing healing, that's really what it is.
I really bought into this, and I was somewhat of a skeptic. I used to kid around with my wife when she would listen to New Age music. I said, how could you listen to this nonsense? And now I'm somewhat of a believer.
When the complementary care program opened its doors, it wasn't exactly universally embraced by the physicians practicing here.
This environment, interestingly enough, I think offends both parties. The staunch allopaths and those who are staunch alternative practitioners. This is not a market for either extreme.
But trying to make Eastern medicine fit a Western model isn't easy. Experiments must be devised and results must be reproducible. Researchers try to iron out the kinks in the new protocols at regular conferences.
So would you run this experiment again, or would you go right to an intact immune system model?
We were all trained as physicians that the mind is separate from the body. You examine the mind with subjective criteria. You examine the body using objective physiologic criteria. But they're fictitious. That's a model. But the reality is they're never separate. The mind always impacts on the body.
Others at Columbia are less enthusiastic, but still willing to try alternative therapies. Dr. Craig Smith, chief of cardiac surgery, also operates with a therapeutic touch practitioner in the OR.
I'm still somewhat skeptical, I guess, but I think remain somewhat open-minded.
One of the things about heart surgeons is people expect you to be a by-the-numbers, hardcore guy, working your tail off, but only interested in the intraoperative part, not about the patients and their minds and anything else.
But on the other hand, aren't surgeons, though, really the natural ones to be trying complementary medicine? I mean, when you think about it, I mean, typically surgeons have just used whatever works. We don't necessarily care how it works. I mean, you'd bay at the moon if that would help in terms of patient outcomes.
As physicians, we generally try to stick by the book, but surgeons are unique in their ability to bay at the moon, to really develop superstitions. And that superstition is based on the fact that anecdotally, we run into cases that work.
It's always been hard to explain why one surgeon sometimes gets better results than another. I don't think there's any question in my own experience. If you transmit your optimism about an outcome to a patient, they receive it.
Many expert observers feel that programs like the Complementary Care Center that bring together philosophies that have been separate for so long, that this may help revolutionize the way health care is delivered in the future.
It has been fascinating to me to watch the culture of medicine in this institution change over time.
I would like to feel I can be skeptical about what they're doing, while at the same time being non-skeptical about what the patients seem to derive from it, because they do seem to enjoy it.
It sort of gave me a feeling of empowerment, that I wasn't a victim in a sense that I was able to participate in the process and in my recovery.
This is how medicine has evolved. The first heart surgery that was done was an experiment. This is also.
Dr. Oz, the research program at the Complementary Care Center has been going on for a number of years now. What kinds of results have you seen? What conclusions can you draw at this point?
Well, we've taken a very conservative approach, looking diligently at questions which we hope will build the foundation in investigating complementary medicine. And what we have found, for example, is that hypnosis is effective in reducing not just anxiety, but also the pain medications that patients take after open heart surgery. Indeed, we have published this data in major cardiac journals. We also have addressed the issue of whether patients can hear when they're under general anesthesia, a topic which has been skirted over in the past, but never really addressed directly. And what we found is that all the patients we investigate have some degree of awareness, and more importantly, by testing that awareness, we actually can condition them. We can change their natural response to events after the operation by what they hear during the operation.
Now let's meet Jerry Whitworth. Jerry, recently there was a lot of media attention given to a study that was published in the Journal of the American Medical Association about a study which seemed to negate the fundamental basis of therapeutic touch.
Right. Left.
And what was your reaction?
I believe that the study was well-grounded in methodology. The question that they asked was properly answered. Their conclusion, though, that we feel as though may miss the mark a little bit, and that actually there needs to be more studies.
What did this do to your research, though? You are studying therapeutic touch. Does it have any impact on how you're going about your studies?
Actually, we're staying focused on outcomes, on whether it can elicit a response, negative or positive, in patients. So we're doing clinical trials, and we're continuing with that work, as well as we're doing basic science research to tweak out placebo effect.
And Dr. Oz, is the complementary approach that we saw at Columbia, is this a precursor of the future of all critical care medicine, do you believe?
There's no question in my mind whatsoever that the approaches to integrative medicine that you saw at Columbia Presbyterian and other hospitals across the country are just the first wave of changes. They're going to dramatically affect the way in which healthcare is delivered in this country. Patients more and more are recognizing that they have to play a role in this process, and as healthcare providers, we're more willing to open up a little bit to allow that process to occur. And it takes growth on both sides.
I think the resistance to alternative medicine comes from ignorance on the part of physicians. And many doctors lead such a harried lifestyle. Their practices are so busy that they have even less time than lay people to actually sit down and read magazine articles in Time magazine and Newsweek about the benefits of herbal medicine and vitamins. So they may actually be behind the general populace, and therefore they feel threatened when people come in and say, well, how about this herb or this vitamin? They're going to just clamp down unless they get the proper training.
We talk about this 1,000-year tradition in one area or another, and the people who were trained in those 1,000-year traditions had this training, and now people go to weekend workshops and decide that they are now ready to practice alternative medicine, and I think this could be a really dangerous proposition.
One of the most high-profile proponents of the use of alternative medicine is Dr. Andrew Weil. Dr. Weil is the author of several bestsellers, including the hugely successful 8 Weeks to Optimum Health. Well, now Dr. Weil has embarked on what may be his most ambitious challenge yet. He's established the fellowship program in integrative medicine at the University of Arizona College of Medicine to try and train doctors in the use of alternative therapies. We spent a day with the fellowship program's first class for a rare behind-the-scenes look at just how Dr. Weil is grooming the future leaders of what he calls a revolution in healthcare.
I think this is a genuine revolution, and I think it is an idea whose time has come, that's now being forced by economic realities. It's clearly what patients want all over the world. I think it's a very fundamental change.
Dr. Andrew Weil firmly believes that in the not-too-distant future, Americans will see the growing availability of integrative medicine as a health choice.
I define integrative medicine as the intelligent combination of the best ideas and practices of conventional and alternative medicine into treatments that are cost-effective, patient-centered, and that work from the premise that the body can heal itself if you give it a chance. I have had many patients who've had very successful outcomes come to me afterwards and say that in retrospect, the most important thing that happened for them in meeting with me was that I was the first doctor who had ever told them that they could get better. That makes me feel very sad in a way, because why should it be that so few doctors tell patients that they can get better? I think that says a lot about how we train doctors.
Here at the University of Arizona College of Medicine, Dr. Andrew Weil has created a program in integrative medicine. The intent of this unique program is to do nothing less than influence the future of medicine by, 1, redesigning medical education, and 2, establishing integrative medicine as its own discipline. What is especially unique about Weil's program, though, is that it resides within a traditional medical school with the blessing and support of the dean.
I mean, the goal of medical schools is to train physicians, and the role of physician is to help patients. And that means you have to look at whatever modalities will help patients, even if they didn't come from the ivory tower.
I think expanding health choices for patients is critical, especially in the face of chronic diseases.
Dr. Weil is not fighting for his healthcare revolution alone. He has selected 4 classically trained, full-fledged physicians from a host of applicants for this post-residency fellowship program.
It's an opportunity, really, of a lifetime. There has been no other physician who has received this kind of training in the United States before.
I feel very excited. I feel privileged. We're doing the first research clinical outcome studies that have been done in an academic setting.
I think all of us were selected because of our obvious interest in medical education. So that is a common factor between all the fellows. And when I'm done, I anticipate going out and starting a program very much like this.
Well, I think the people that finish their fellowships here are going to be the academic leaders in integrative medicine across the country.
I was raised in the hierarchy of internship, residency, fellowship. Getting subspecialty training in a fellowship made perfect sense to me, and coming to a university setting is ideal.
Dr. Karen Koffler was a critical care physician in Denver before joining the program.
We were only sustaining life for perhaps weeks to months, and really felt strongly like we needed to start concentrating on the other end, keep them out of the hospital as much as possible.
The fellowship program is designed to give conventional doctors training in the various alternative medicine modalities and to give them some research experience as well. The program neither rejects conventional medicine nor does it totally embrace everything in alternative medicine without looking at it critically. What they really want to do here is to take the best balance of both so they can give each individual patient the best possible care.
If you had a woman, for instance, who's menopausal, who under other circumstances would be put on hormone replacement therapy, how would you make the decision as to whether to start her on her Premarin and so on?
Based on looking at her personal history, family history, and risks of various categories of disease. And we may end up recommending hormonal replacement.
As opposed to herbal?
Yeah. Yeah.
So it's strictly individualized. It's
Exactly.
not, there's no pro forma.
No. No. No, we go by, you know, we try to treat each individual as an individual.
To provide individualized treatment, fellows spend as much as an hour with each patient.
Has anybody sat down and gone over with you carefully things like your diet?
No, not very carefully.
Okay.
We are expected to do exactly what we've been trained to do, and it's what I know to do, which is take a routine history that we have embellished quite a bit, and then go through a physical exam as we would previously, and we add to it the things that we've learned, for instance, from osteopathic manipulation and also Chinese medicine.
Dr. Weil teaches the fellows that integrative medicine requires an understanding of a patient's spiritual as well as physical needs.
What kind of goals do you have?
I have spiritual goals. I have fitness goals.
Ann Kramer's pancreatic cancer is in remission after conventional treatment. Now she has come to fellow Roberta Lee to improve her overall health.
And she was last seen at the oncology department here, and I think she's doing really well. She feels well. And she's here to maximize her health and have a lifestyle consultation for her diet and exercise.
Yeah, that's quite a story. You've done remarkably well. Yeah, that's great. Are you feeling well? Appetite's good? Digestion's good? Amazing. That's great. Well, we'll try to give you some suggestions to keep it up.
Each new patient visit is followed up later that day at a conference where the fellows present their case histories and physical exams to Dr. Weil and to a variety of health practitioners, including a pharmacist, a psychologist, and others experienced in conventional and alternative medicine.
And they had broccoli sprouts.
Really?
Nice containers of beautiful fresh broccoli sprouts.
Their
so I just
organic
brought one.
broccoli is really good. I like
Right.
that.
But so I would, I mean, that's something you can tell this guy to start eating.
Dr. Wendy Kohatsu gets input from a pharmacist and a psychologist to help her address the physical and emotional needs of one of her patients, a 61-year-old man with metastatic colon cancer who's being treated with conventional therapies, including chemotherapy, but still feels he isn't coping well enough.
I think something to bring it, the emotionality, I mean, something to let him bring it to the forefront, because he's obviously doing it at one level with the motorcycle, with, you know, the quality of his life.
He can use that motorcycle riding and where he's developed some emotional passion for it, plug that right in, so he can be rehearsing that mental imagery along with those feelings when he's sitting in his easy chair at home and can't be out in the weather riding. So the two can really go together and use that as the vehicle to tap into the emotional side and the vitality.
But then in addition to all this, I think if he's not gonna do the chemotherapy, he should do some major, no, not a regimen, some therapy. Yeah, something. Some anti-cancer therapy.
Like what?
Well,
would Hoxie be something?
Hoxie is certainly a possibility.
Hoxie is a combination of herbs that the doctors plan to discuss with the patient and his oncologist as a possible treatment option to be combined with chemotherapy.
It is exciting to be able to offer patients who have basically reached the limits of what Western medicine can offer, and to have things to offer with legitimacy. We're obviously looking into a lot of new things. We're doing a lot of research into what is valid.
Although Dr. Weil is a Harvard-educated, classically trained physician, his professional peers don't always share his faith in alternative therapies.
What did your doctor say when you told him you were seeing Dr. Weil?
His exact words were, "You still taking that voodoo medicine?" and he's a very good doctor. They're just not trained, I don't think, in the alternative method.
45-year-old Lyle Trotter had been going to his conventional doctor to treat his hepatitis C with the drug interferon. Trotter says the drug worked to fight the virus, but there were side effects, and when he went off the interferon, the virus came back. But after seeing Dr. Weil and trying various herbal remedies,
it went real well. All liver enzymes, all tests are normal and have been for a year and a half.
While it may be too soon to judge the overall success of the program, the fellows are willing to offer some preliminary evaluations.
So what do you see as the biggest plus?
The biggest plus is I get to have that relationship with patients that I think has nearly ceased to exist in the way we're practicing medicine now.
We're really building a bridge between what we know, the best of Western medicine, and the best of alternative types of therapies.
We're going to be going out and hopefully starting new programs and educating, you know, the new generations of physicians and medical students. I think that it's an opportunity to contribute to that bridge.
Dr. Weil, looking to the future, once your fellows have left your program, they've returned to practice or teaching, what do you think this is going to mean to the American public, to the medical consumer?
I think eventually it's going to result in a new generation of physicians who are trained to be open-minded about alternative therapies, who can incorporate these into their practice, and who also will operate from a different perspective, especially putting emphasis on the body's natural healing powers.
But do you think possibly the economics of medical care these days, and managed health care in particular, might get in the way of the sort of quality doctor-patient relationship that you and your fellows advocate?
It already has. This is the great complaint that physicians have no time anymore to practice the art of medicine, to do the kind of listening and communicating that's necessary. I think that has to change, and our challenge is to demonstrate the cost effectiveness of the integrative model. Our contention is that by investing more of a practitioner's time up front and practicing medicine in the way that we're training physicians to do, that we will be able to demonstrate net savings down the line in terms of lowered utilization of practitioners' time and lowered costs of therapeutic interventions.
And you've said that you really would like to see new types of clinics in which the practitioners of all these various systems would work under the same roof. Tell me exactly what you mean by that. Is that just an extension of integrative care?
Yes, I can envision healing centers in which patients could come, especially to have lifestyle analyzed, that could learn about healthy lifestyle, and that different kinds of practices would go on under the same roof. But it's not enough just to have these juxtaposed in the same physical structure. There has to be integration on the conceptual level as well.
In the futures, we're going to see a very integrated style of medicine where we're going to have all the tertiary care facilities that we've grown accustomed to, the high-tech medicine, incorporated together in a facility where other modalities will be offered, softer modalities like massage and touch therapy and herbal therapy, vitamin support, information about how to change your lifestyle with diet and exercise. And all these things will come together, and I think that that's a model that Andrew Weil is trying to capture, and in various centers of excellence through the country, they're starting to realize this ideal, and I think that's going to be really what's going to happen in the next millennium.
If Dr. Weil is the standard bearer of a revolution to change the way medicine is practiced, then an advanced outpost of that revolution is here, the Arizona Center for Health and Medicine in Phoenix. We toured this cutting-edge clinic that integrates traditional and non-traditional treatments.
You have highly credentialed physicians that are committed not only to Western medicine, but also to whatever other types of integrative medicine and complementary therapies that they are into.
The Arizona Center for Health and Medicine in Phoenix is a clinic with 5 MDs, 2 osteopaths, and 1 naturopath that is making the theory of integrative medicine a reality for patients. One of the things that's really unique about this center is that patients are offered a wide variety of conventional and alternative treatments all under the same roof. The way the clinic is decorated reflects its unique dual nature. You notice when you enter that there are no stark white walls, there's no harsh lighting, not even any white coats.
This particular exam is a little bit of an exception in that it's a procedure room, so there's only one of these in the office, but we do have electrocardiograms, sigmoidoscopes, suture.
All the standard stuff.
All the standard stuff.
So the area that we're entering now is what?
This area is called the Zen Meditation Garden.
In this serene environment, the center offers patients a wide variety of conventional and alternative treatments, including acupuncture and another form of ancient Chinese medicine known as cupping.
We're putting the flame in it, and it uses up all the oxygen, and then creates a vacuum and pulls the skin up. And it's like a very deep massage.
What we're doing here is integrative medicine, which is to combine the two together so that it's no longer one or the other, or two side by side, but really integrated. For example, I saw a patient who had an acute viral syndrome. I did a strep screening on her because I was concerned that it might be a pharyngitis due to strep infection. At the same time, did an acupuncture treatment to try to release some of the heat in her body that was accumulating because of the fever. I called her the next day and said the strep screen was negative. She said, "I'm totally better after the acupuncture treatment. Thank you very much."
I think the beauty of the particular center is that we have that liberty, really, to be able to have a multidisciplinary approach. And so we have, of course, our weekly meetings to discuss, cases that might be particularly refractory to our perspective or our approach, and then be able to get others' input on it.
Deborah Heath brings her training as a doctor of osteopathy and her belief in that type of medicine to complement the more traditional treatments available at the center.
Does that sore to you at all, Zachary, on that rib right in there? What I would do is have a palpatory examination that is unique to the osteopathic exam, and in that physical examination can determine areas that have restriction of motion, that have asymmetries, and even have tissue texture changes that have a quality to the tissues that in fact would contribute to that complaint or that symptom. Then with light touch and putting different areas into a balance, that automatic self-correcting mechanism will restore full function to that region.
I've learned through Dr. Heath and several other doctors how osteopathic manipulation treatment can keep the body healthy as a preventative form of medicine, as well as when he had started getting ear infections, that to try to treat him with the medical care without going to antibiotics, and it worked. It worked fabulously.
This was my last so-called last resort to the problem here.
15-year-old Frank Romo came to the center for help with a lifelong stomach problem that wasn't responding to conventional medicine. Frank was treated with alternative therapy by Dr. Abraham Karuvila, a traditional family practitioner who also prescribes alternative medicine when warranted.
I saw him about 3 months ago as a 15-minute visit coming through the primary care side with abdominal pain. And it was obvious that he was impacted with stool.
I was feeling very, very sick, very weak, low energy, not really feeling like doing much.
Given the option of mutilating surgery on a teenager, I sat down with the family and I told them that we should try other things, alternative things. And we decided to start acupuncture and approach his colon on an energetic basis and supplement some traditional Chinese medicine to help that.
I feel very good. To this day, I've been feeling very good. A lot of people have been noticing my attitude has changed about everything.
Frank credits the alternative treatments and especially his relationship with Dr. Karuvila with saving him from having surgery.
He taught us that among ourselves we are specialized and we can bring our specialties together into a case in a logical sequence and get where we want to get.
And Dr. Karuvila was very down to earth, and he spoke to me, you know, about things that I knew, and got to know him very well.
My experience is that 80%, 75 to 80% of the effectiveness is the relationship. There is definitely an effectiveness of the modalities as well. The modalities themselves lend themselves to a richer sense of what the patient's all about, because you have to inquire about emotional, spiritual, mental, and as well as physical symptomatology to administer these modalities. So right there you've expanded the relationship in terms of the focus.
One of the big problems that traditional Western medicine has with integrative or alternative complementary medicine is the science that lies behind it. So often, conventional physicians will complain that there are no controlled studies that back up what we're doing in integrative medicine, but that's often so far from the truth. There's a lot of information that's available about a lot of remedies that are very credible, and I think that's what's really fueling this from within the medical community as they see that there's information and research. It's not just one patient saying that their aunt's best friend got better by taking cayenne pepper. It's that they're seeing that there are clinical studies to back up the use of a lot of these treatments.
I think 5 years ago, 10 years ago, when we're struggling to bring some attention to this field, I think everybody's very hopeful. Now that the consumers are clamoring for it, the students want to learn it, and everybody is jumping on the bandwagon, so to speak. So I think there are things to worry about, because anything that's faddish and fashionable, which this whole field is now, it might backlash, and it may take a couple of good studies to show that perhaps glucosamine doesn't work, perhaps growth hormone is going to cause cancer, something like that, and then it will make us all look bad.
Of course, not every doctor is jumping on the bandwagon in support of alternative medicine. Some remain unconvinced and frankly concerned about this growing trend. One of those is Dr. Arnold Relman, Professor Emeritus at Harvard Medical School and Editor-in-Chief Emeritus of the New England Journal of Medicine. Also rejoining us is Dr. Andrew Weil. Dr. Relman, you've said that there is no such thing as alternative medicine. What exactly do you mean?
Well, I meant by that, and I still believe, that there is only medicine, therapy of various kinds that either works or does not. That's either been put to the test or not. And I don't see the benefit or advantage or rationale to use the term alternative medicine. Anything that has been proven to be safe and will work will become part of standard traditional medicine. And a lot of things that would have been called alternative medicine when they first started are now part of what every doctor uses. So I don't get the point of the distinction.
Dr. Weil, do you find that agreeable?
Yes and no. I think it is true that as medicine evolves, it constantly incorporates techniques that have been outside of the mainstream. So at the moment, it's worth looking at what's outside of the mainstream to see what we might incorporate. I don't like to use the term alternative medicine because it suggests that we're trying to replace conventional medicine, and that's not my aim. But I do feel that there are many treatments out there that our physicians are not being educated about, and a good example is botanical medicine, which is my own area of expertise. There really has been a tremendous amount of testing, good research done on many botanicals, and American physicians are simply unaware of that. They don't know of the existence of the research, and it's a subject that they're not exposed to in their medical training.
Well, testing brings up an interesting point. A lot of people, as you know, say that maybe the testing hasn't been quite as rigorous as we would expect, certainly in what we would call conventional medicine. Do you think that the testing that needs to be done for alternative methods is basically has to subscribe to a different burden of proof?
I think it should be just as rigorous. I think scientific method is scientific method, and I don't think there's any reason why we can't apply it to alternative therapies.
I don't agree with what Dr. Weil has said. Anything that is claimed to be worth doing, that is claimed to be effective, should be put to the test. And it should be put to the test in the most rigorous way possible under the circumstances. A lot of claims are being made for the therapeutic effects of herbs or tonics or whatever that have never really been put to the test. I say, let them be put to the test. And when you test the therapeutic effect of an herb or some natural product, you have to know what you're testing. You can't test something when you don't know how much of the active substance is there. And medicine has a 200-year history of trying out herbs and roots and natural products, finding that a few, not many, appear to be effective, extracting the active molecules, identifying the molecules, and testing them in a quantitative and objective way. If that's what Dr. Weil is talking about, I say fine, let's do it. Now, I read the medical literature as carefully and as critically as any man in the world. And I've probably had more experience in evaluating scientific medical evidence than most anybody else. In my opinion, there is simply little or no evidence for the effectiveness of many of the natural forms of therapy that now are called alternative medicine. And that's my criticism.
Dr. Weil, I'm curious. I mean, a lot of what we hear these days as to why people are accepting of alternative medicine is because this is something that the patient wants. How much of this is really driven just by patient request versus actual patient need?
It's hard to make that distinction. I think patients are demanding something, and those demands come from real needs as well, and I now find that large numbers of physicians are beginning to respond to that. The fact that this is a consumer-driven movement does not discredit it. It is a pressure being brought to bear on the medical profession, and the profession is beginning to respond to it. In terms of the testing issue, I think it's worth noting that the kinds of testing that we've been doing have not kept a great many worthless and dangerous therapies out of conventional medicine, and that many of the things that are done in conventional medicine have not been put to the same kind of rigorous testing that Dr. Relman asks for alternative therapies.
Is this one of those areas, Dr. Weil and Dr. Relman, either one where we're just going to constantly go back and forth, or is there really a definable standard by which we can say, okay, we're going to look at herbal medicine or we're going to look at touch therapy and we can test it this way with precision and find out does it work or doesn't it?
Certainly with herbal therapies, there's no reason why this can't be tested in the same way that we now test pharmaceutical drugs. I think the issue of whether we identify an active constituent and isolate it, I have problems with that, because in some cases it may be a synergistic interaction of a number of compounds in a plant that produces a desirable effect, and that the standard reductionist approach of taking out one element, we may lose some of the therapeutic value in the natural product.
Well, Dr. Weil, we live in a world of molecules. Every natural substance is composed of molecules. The human body is composed of molecules. If there are molecules or compounds, collections of molecules that have a therapeutic effect, they can be identified, they should be, and the therapeutic effect should be quantified, should be measured. I don't I don't accept your premise. It sounds sort of mystical, and that's one of the things that bothers me. We either go by the rules of basic science, of physics and chemistry, and the evidence-driven approach, that is advanced medicine to where it is today, or we move to mysticism and faith and good wishes and hope. And I don't object to mysticism or faith or good wishes if it makes people feel better, but I object to being dishonest about it. I object to practitioners of so-called alternative medicine making claims that simply cannot be verified.
And briefly, gentlemen, one last thing here. Do you think, between the two of you at least, that there's any common ground here when we talk about integrative medicine or alternative and conventional medicine?
Well, I would just ask this of Dr. Relman. It seems to me that it is indefensible to argue against the proposition that at the very least our physicians should be aware of what these methods are that their patients are using. So that simply to teach in medical school what the difference is between a chiropractor and an osteopath, for example, or to let physicians know what these basic botanicals are that patients are using, I can't see how anyone could argue against that proposition.
Dr. Relman?
I can't object to that. I do object to teaching that these things are effective without the evidence. That we should know what people are doing and what people believe, that's fine. But let's not distort the truth. If we don't follow evidence, Dr. Weil, we're lost. And I urge you to follow the hard evidence, to ask for the hard evidence and follow it.
This is a complicated issue. On the one hand, I certainly believe in evidence, and I'm open-minded and willing to look at all propositions out there, but then I want to see evidence for them before I'm going to use them or recommend treatments to other people. But I also feel that there is a change coming in the nature of science, that it is not purely an objective reality that we live in, that the observing mind has an influence on objective reality. And just in this matter of molecules, I have seen in my own experience as a botanist and person interested in natural products that the effect of a whole plant product is often not reproducible by a single element taken out of the plant. So this is a different perspective. That's my experience at comparing plants with isolated active compounds. In Chinese medicine, the practitioners believe that when you give a mixture of herbs to a patient, that you can't attribute a beneficial effect to any one herb, let alone any one component of an herb. So that's a different perspective on the way that I view the natural world.
Say what you will about alternative medicine, I believe a corner has been turned, and it will become less alternative and more mainstream over the next few years. This will probably happen mainly for pragmatic reasons. Medical consumers are looking for that something else in their health care to try and pick up where traditional medicine leaves off, and many traditional physicians are adding alternative medicine to their practices, often as much for that old adage, if you can't beat them, join them, as they are for medical reasons. Alternative medicine offers a wide variety of modalities or treatments, but one fundamental distinction almost all alternative medical practitioners claim is at least partially responsible for their success is the relationship they establish with the patient. They emphasize spending time with their patients, exploring emotional and spiritual needs as well as physical ones. As it turns out, that has also long been the goal of traditional Western medicine, that the secret of caring for the patient is to care for the patient. So in at least one major respect, alternative and traditional medicine may not be quite as far apart as they seem. Yet one nagging question remains. Do the various alternative approaches and treatments have any intrinsic therapeutic value? That is, do they really work and give predictable, reliable results? Well, in many cases, that still needs to be demonstrated, and academic programs in integrative medicine at Columbia and the University of Arizona and elsewhere will hopefully answer that with their ongoing research. In the best of all worlds, the research and the clinical experience will let us put together truly integrated care, taking what's best from both traditional and alternative medicine.
All of us at this table agree that medicine is endlessly humbling profession. And if you've been in medicine for more than 5 years and you're still cocky, you're probably in the wrong job. And who would want to limit their possibilities? So of course, you try to embrace everything, but I think the trick is to stay intellectually rigorous throughout that process.
In this era, this sort of new freewheeling era, it becomes very incumbent upon both the practitioner and the patient to really be very careful in terms of selecting who they're going to for medical advice.
I do have some worries, and I'm actually encouraged that a lot of us here tonight have expressed caution and the emphasis on good research as we move ahead.
I think that in the future, more and more physicians are going to be incorporating natural therapies into their practice. I think that patients are going to be much happier with more open-minded, broader approach, and they're going to feel more empowered and more hopeful in their healing. And I think more and more physicians are going to feel more gratified by the results that they're going to get by a broader approach to healing.